Sometimes it's confusing as to whether or not you have anxiety or if you have an anxiety disorder. Anxiety and stress are very common and typical. However, when anxiety meets criteria for generalized anxiety disorder, then you have a DSM-5 condition. Here's how you can tell if you have anxiety or generalized anxiety disorder. Generalized anxiety disorder has the following criteria based on the DSM-5. Excessive anxiety and worrying on most days for more than 6 months. And this is excessive worry about things that people typically don't worry about. It has to be a number of activities or a number of worries. For example, excessively worrying about bills, excessively worrying about work, excessively worrying about whether or not people like you, excessively worrying about whether or not something bad is going to happen. The key is excessive. Again, worrying is a part of being a human, but excessively worrying to the point where it's creating problems for you is another story. The next criteria is that it's difficult to control these worries. So most people, when they have worries, they can actually say, okay, I'm worrying, but let me actually do this, or let me get back to my work. But with people who have generalized anxiety disorder, it's very difficult to control these worries. It's consuming. Also, the anxiety has to be associated with 3 or more of the following symptoms. Again, because of the mind-body connection, a lot of these symptoms are physiological. They're based in the body. Number 1, restlessness. So the person will say that it's hard to sit still. They feel keyed up. Number 2, easily fatigued. That makes sense. If your body's under constant stress, it wears on you. Number 3, poor concentration. Your mind goes blank. If your brain is using a lot of its energy on the worries, then you forget about the details that are actually happening around you. Number 4, irritability. This one's important. A lot of times people say, oh, this person's angry, but actually they're anxious. When your body's under stress, it's really difficult to regulate. Number 5, muscle tension. A lot of people who have generalized anxiety disorder will say that their bodies are sore, they have back pain, they have tension in their neck, their muscles are sore. So they may end up actually going to the medical doctor thinking that they have a neurological condition in their body, but it's actually anxiety. Number 6, sleep disturbance. If your brain can't be quieted and it's constantly worrying, it's hard to get deep rest. So a lot of times people will say that they wake up in the middle of the night with the sweats, or they wake up in the middle of the night with their heart racing, and it's because of anxiety. So in order to meet criteria, your symptoms can't be better explained by another psychiatric condition or another medical condition and can't be caused by a substance. The anxiety has to cause significant impairment, either socially, career-wise, academically. And again, this is not the same as other anxiety conditions. So there may be overlap with other conditions, but this is generalized anxiety disorder. Generalized anxiety disorder can be treated with medications. It can also be treated with types of therapies. One of the most common therapies is cognitive behavioral therapy. But mindful behavioral therapy and mindfulness can also be very helpful. Another type of tool may be somatic therapies. And in some cases, generalized anxiety disorder actually travels with depression or other medical conditions or other psychiatric conditions. So you may have to also address those conditions because they co-occur. Generalized anxiety disorder runs in families. And it's not uncommon that for people who have medical conditions that worsen the physiological symptoms of generalized anxiety, that they have to also get those medical conditions addressed as well. What did you think about this video? Did you learn something new about generalized anxiety disorder? Did I leave something out? Let me know in the comment section.